it's what every mom dreams of, sleeping soundly, sleeping uninterrupted. And sometimes we have a hard time doing that. Sometimes we can sleep 9 or 10 hours. We say we're catching up, right? Well, sometimes moms dozing off during the day, also a problem. And we all just say, hey, we're just busy, that's life, right? But it could actually be a sign of a heart problem. Valley cardiologist Dr. Jack Wolfson with Wolfson Integrative Cardiology joining us this morning to talk about this. You know, I have to admit, a lot of times I'm just like, oh, I'm just tired. But you say, Tess, women really need to pay close attention.
Well, sleep is extremely important. Every disease is associated with sleep problems.
Okay.
And women, men, everybody need to be conscious of getting the appropriate amount of sleep. We definitely should go to sleep with the sun down and awake with the sunrise, which is not very common for most people. Most people are night owls. They're staying up, to the late hours. But that's not how our ancestors did it. That's not how our bodies are designed. And
it's hard to do that when you say work a different shift, a different schedule, whether you're like us with a morning shift, a late night shift. What should be some of the signals that we should look at that we may pass off as just, oh, that's normal?
Well, recently there's been a lot of publicity about the fact that there's an increased risk of stroke and cardiovascular events, especially in a large study of female nurses. And what they found that those women that slept the least, less than 6 hours, had a 2 times higher rate of having a stroke, which is not insignificant. So once again, it highlights the fact that especially in these nurses and in anybody working the night shift and different things, that we need to get that sleep. It is absolutely precious, and the health ramifications are tremendous.
And we are looking at some of the problems that it could lead to, as you were mentioning. What do we do about this? I mean, it's easier said than done. Oh, just get more sleep.
Well, we have to plan for sleep. Like I said, go to sleep with the sun down.
Okay.
If you have troubles sleeping, turn off the television set. Turn off your cell phone. Just read a book to help you get to sleep. Try and get the electronics out of your bedroom. Those electronic items can be very stimulating. Lights can be stimulating and prevent you from sleeping also.
Now, what are some of the signs of a bigger issue? I mean, you talk about the risk. It's 2 times greater with less than 6 hours of sleep. What are some of the things that could become a bigger issue?
Well, we could talk about the signs and symptoms of having a stroke. Slurred speech, loss of your muscle function on one side of the body. We can talk about problems with your vision. There's a lot of symptoms. Pretty much the loss of some kind of function should trigger the person into realizing that they're having stroke-like symptoms and seek out immediate attention, because time is absolutely critical. If there's something that doesn't seem right, get it checked out by a medical professional.
Go with your gut at that point, right? Do you think women ignore a lot of these signs, though?
I think women definitely ignore, these signs. They're too busy doing a lot of different things, in our house with my wife, busy running around with the kids. I mentioned my wife, and actually that also brings to mind the fact that people from the ages of 18 to 34, they have an 8 times risk of having a stroke when they have poor sleep. So think about that category of people where they are not getting that amount of sleep. They're busy with their lives, they're studying and finals and whatnot. The overall risk is still low, but it's an 8 times higher risk as compared to somebody who's getting enough sleep.
Well, hearing about these numbers and the statistics is definitely scary. Dr. Wolfson, thank you so much. We'll put all the information on how you can learn more about this issue and, of course, talk to Dr. Wolfson on our website, azfamily.com. Thank you so much for shedding some light on the problems and risk of heart disease for